You ready to do it?
Yes, ready to do it.
All right, Shanta, here we go. So 5, 4, 3, 2, 1. All right, folks, welcome back to the Trauma Therapist Podcast. Very excited to have today as my guest, Shanta Kanukollu, a.k.a. Dr. K. Shanta, welcome.
Thank you so much for having me. I'm honored to be here.
All right. So Shanta has over a decade of clinical experience working with clients of diverse backgrounds in the forensic and medical settings. She attended the University of Michigan for graduate school, where she received her dual doctorate in clinical psychology and women's studies. She currently has her own private practice in downtown Chicago, where she provides psychotherapy to adults from diverse backgrounds. Dr. K also provides education and outreach regarding mental health outcomes in ethnic minority communities, with a particular focus on the South Asian population. Through her writing and professional speaking engagements across the country, Shanta, welcome to the podcast.
Thank you so much.
So before we get going here, share with our listeners where you're from originally and where you are currently, and we'll dive in.
Sure. So I am originally from New Jersey. I was born and raised in New Jersey. I'm the first generation to be born here in the United States. My parents immigrated from India in the 70s. And I spent most of my childhood in New Jersey on the East Coast. I went ahead to undergrad at Rutgers University, where I graduated with a dual degree in psychology and public health, and then lived in New York City for a little bit doing research, and then made it my way to the Midwest for graduate school at the University of Michigan.
Okay. Well, let's dive in there. What drew you to the field of psychotherapy, of clinical psychology, and so forth?
Absolutely. So as I mentioned, my parents are from India, and like so many other people of my generation from my cultural background, there was a desire on their part for me to be in a more stable and more respectful career path, which, as the stereotype goes, is usually in the field of medicine. And so I grew up thinking that was my path, and it wasn't any explicit pressures placed on me. It was sort of, I think, what I thought was the next step, specifically because I grew up in a community in New Jersey where there were many other South Asian Americans. And so there was sort of this culture, unspoken sometimes, spoken sometimes, that we would be here in professional settings in the future to make our parents proud, but also to be in stable jobs, right? Because I think that's the immigrant dream, that you come to this country to have a better life for yourself, but also for your future generations. And so I think just from that lens, I later understood that to be a product of trauma, right? Like coming from another country can involve a lot of hardship. And so you want it to be worth it. And so you give these messages to your children that they should be safe and stable in whatever they choose to do. So I thought I would be a medical doctor, but I found myself really not enjoying the coursework and finding very little passion in the coursework, unlike so many of my colleagues and friends who were feeling differently.
So in undergrad, did you do pre-med, or in graduate school, did you do pre-med?
So I started pre-med and found myself feeling really, really out of sorts and really out of place. It was the first time that I found myself struggling academically too, which was, new for me, given that, again, I was from this higher pressure community and did pretty well in school, that there was a clear correlation between my mood and my difficulty with feeling authentic to myself, and then my academic outcomes, right? And so I fell into psychology. I took some courses and fell in love. I adored the subject. And I think my family noticed that too, because once I did start taking those courses, opportunities came up, my academic record improved, my own mood improved. But I did find in the field, there was very little at the time. This is in the early 2000s, very little really mentioned about people who look like me, or like my family, about mental health outcomes in our community. And there was some dabbling on cultural psychology and ethnic minority psychology. And so I loved those courses especially, but I found a really big gap when it came to Asian American psychology, let alone South Asian American psychology. So that's how I fell into the field. And I found it was linked to pre-med in many ways, right? It was still
Mhm.
people oriented, it was still health oriented, but it wasn't the body that I was interested in. It was the psyche that I
Yeah,
was
well,
really.
it is, there's a definite distinction there. I mean, I had a very similar path. I it was more self-imposed. I grew up thinking like I wasn't really smart. And so I want to become, I mean, it was circuitous reasons, but I pursued becoming a medical doctor, and the coursework was just not in my cards. But the, you know, talking and relating
Mhm.
was. But I want to go back to one thing you said. You talked a little bit about, you referenced a little bit about uh, maybe feeling a little bit of pressure, and you kind of brought in the word trauma in there. Talk more about that.
Sure. So where I grew up specifically, there was a very close-knit South Asian community, and it was wonderful in so many ways. Unlike so many people who look like me or my generation, I had access to food, language, dance, religious school at my fingertips because I was from this very rich part of the country where there were so many immigrants. So it was an honor and it was very special in many ways. But I think there was also um, a downside, which was that people really were so close knit that they also started to maybe look to each other for advice or career path, or the older sibling talks to the younger generation. There becomes this way in which we cling on to each other because there's no other community that we feel supported by, or we don't know if anyone else will understand our experience, right? So there becomes this tight knit community that, again, lots of strengths there. But then when you don't have anyone to help you through college applications,
Mm-hmm.
or because your parents didn't go to school here, right? You're sort of figuring it out and relying on people of your own generation or your cousin in another state or the kid 10 years older than you down the street. You're clinging on to each other, and your parents too do the same, right? They cling on to their religious communities. Again, this is not for everyone. This is not the case for everyone, but this is what I experienced.
Sure.
And so it was really hard to know what else is outside, right? And so there's a level of safety that comes from being with your own, safety from perhaps discrimination, safety from perhaps, quote unquote, bad American things like drugs and sex, right? It's a way to cope with, I think, fear of
Mm-hmm.
the unknown, right? And so when you come to a new country, my parents are very lucky in that they came from an educational background where they spoke English and they had college, careers themselves already. But still, even with those protective factors, there's still so much unknown, right?
Right.
Still so much fear. And so I think you transmit intergenerationally this idea that we have to stay safe,
Right.
we have to stay stable. And these are the ways we know how to do it. So please cling on with us to
Mm-hmm.
this boat and stay with us, stay close to us. So you're not going to be in harm's way in this new crazy language and culture.
Now, in terms of uh, perspective on mental health, access to mental health, talk a little bit about the South Asian community. I mean, how do they look upon
Mhm.
talking about mental health?
Sure, sure. So again, this is a wide generalization because there are so many people that fall out of this generalization. There's so many that actually lean into mental health. But growing up, I did notice, which is what drew me to the subject itself, is that there was a lot of silence around mental health problems, or perhaps limited language
Mm-hmm.
about mental health problems, right? So similar to other cultures, right? I never really heard the words anxiety, depression, hallucinations, abuse, trauma. Those were not words I ever heard, honestly. And so if you don't have that language, right, how do you understand certain experiences that are happening to you in your body?
Right.
How do you understand somatic experiences of trauma? Or how do you understand when you feel alone or you're falling into a depressive episode? And so if you don't have the language, then often you don't know who to talk to. And so it becomes, circular.
Mm-hmm.
If I have no one to talk to, or if I talk to my priest, or if I talk to my aunt, who I look up to, and they also don't have the language, then I guess I have nowhere to go. And
Hmm.
so I think I found there to be a gap in seeking mental health services, in finding mental health services. And even if people had the means to do so, I think there was a lack of awareness about what therapy or psychiatry, psychiatric
Hmm.
medication, even, what is it exactly?
Right.
Like, so you talk to someone outside of your family and they're going to try to understand you, even though you're from a completely different culture. Right. That makes no sense. Right.
Right.
So there was limited conversation about it, about therapy and about mental health symptoms. And then I think barriers to figuring out how to even approach it because it
Hmm.
was so mysterious, like a black box.
So when we're talking, and forgive my ignorance here, when we're talking about South Asian population, South Asian communities, what are we talking about specifically?
Yes, no, thank you for asking that. It's often confused with Southeast Asians. I really appreciate that. So when I'm talking about South Asian, I'm talking about individuals from India, Pakistan, Sri Lanka, Bangladesh, um, Bhutan. That is separate than Southeast Asia, right? Which
Okay.
is Cambodia, Vietnam, very different immigration stories and historical context there.
And you had mentioned earlier on when there was kind of an initial nudge from your parents, maybe even your community, to pursue medicine.
Mhm.
How was this shift looked upon? How
Mhm.
was just what are you doing? You know.
Yeah, yeah. It just so happened there were people in my family in India who were in the mental health field. So I was lucky that it wasn't completely foreign to them. But I think there was still fear because they didn't know what that meant in the US
Hmm.
context in terms of income, salary, trajectory. What do you do with it? Is it stabilizing? Are you going to be okay when we die? Are you going to be all right?
Right.
So I think that my path wasn't as challenging as it could have been, but it certainly was something I had to really prove to them
Hmm.
that it was a topic I was serious about. It was a field I was serious about. I think when I ultimately got into a graduate school, right, I was getting my PhD, there's also words they understood a little bit more of. It felt like they could grab on a little bit more to that. Like, okay, you're getting more education. Education probably equals security. I think you're going to be okay. There was
Hmm.
maybe a bit more relief. Um, but in the larger community, I think it was very confusing to people at the time. Not so
Hmm.
much now, but I had experience where people would say, "So, what are you going to school for?" Psychology, crickets. Just awkward crickets and silence, right? Because they don't know what to ask me. They knew the follow-up questions for every other field, right?
Right.
Oh, what
Right.
school? What specialization? How long is fellowship? How long is residency? Or law school? How many years is that? Or where's your, first job or internship going to be?
Right.
But again, there was no language or knowledge about it, and so yeah, I didn't really know where to go with it. And there were times too when I would say I'm specializing in ethnic minority mental health. I'd like to focus on South Asian mental health. And I remember someone specifically saying to me, he was someone of my parents' generation, he said, "But we don't have those problems. What do you mean?"
Hmm.
Um, which is so interesting. I don't even know if you remember saying that to me, but I'll never forget it, right? Because I thought, how are we some, special human community that just can be a kryptonite from all these things?
Right.
This is a human experience that's impossible, but it spoke to so how limited conversations were about these topics.
So let's dive a little deeper here and get more specific about what it means. And I realize, I mean, this is every case is specific and unique, but what does it mean to be working with the population you're working with? How is it different? Is it different?
Yeah, so it took me a long time to actually work with this population. When I graduated from graduate school, I still was not finding South Asian folks coming to therapy. And so I knew I wanted to focus on ethnic minority psychology or working with underrepresented individuals. So I found myself working with people of African American backgrounds or who are Latino, Latina. I worked at Cook County Jail here in Chicago. I worked in the probation setting in Illinois at Lake County. And I always wanted to use a lens of being culturally appropriate, culturally aware, culturally sensitive to how every person in front of me was going to have a different experience of their insert mental health issue, right?
Mm-hmm.
Of substance abuse, of depression, based on their gender, their religion, their family's understanding of mental health, right? Their family's openness to help seeking. And so it took me a long time though to realize that I wanted to eventually move into private practice. And now I see there are South Asian folks coming to therapy.
Mm-hmm.
And they say to me constantly, gosh, I am so relieved that I don't have to explain certain things to you. I think
Right.
you get it. Do you get it? I'm not sure if you get it. Or do you understand what I'm saying? And I'll say, I sometimes I don't, because maybe they're from a different part of India or a different language. Because there are many, many, many different languages in India, right? And cultures and religions. But many times I do. I'll say, I know exactly what you're talking about what that holiday looks like, or what the pressures to have a specific type of wedding looks like, or what it feels like to figure out, a career path that's maybe non-traditional. So this isn't the case all the time. There's some people who say they don't want to work with a South Asian therapist if they're South Asian because they have felt othered in the community. They don't feel connected to their South Asian heritage or community. They felt rejected by them, maybe growing up or whatever might be the case. But the ones I work with, there is a really cool rapport that's built based off of not having to explain some of the nuances of what it means, right, to have an immigrant parent from that specific part of the world.
Do you feel that you need to reach out to people? How are people who might otherwise not feel or not even have the language for certain feelings or emotions, anxiety, etc.? How are those people getting access to mental health care? And what is your role in that, if any?
Yeah. So when I decided to move into private practice, I found myself thinking hard about leaving the community level work and really feeling grief that I was leaving community level work because I love working at the larger community level. So I decided for myself that I would do therapy in my private practice, but I would always carve out a specific amount of time each week to do community oriented work or outreach. And so what that looks like, honestly, is doing things like this, being on podcasts where hopefully someone will hear this and say, yes, thank you. Or let me send this to my parents, or let me send this to my younger sister who's been, thinking about therapy. Podcasts, writing for South Asian online magazines. I have an Instagram page, which has really become a labor of love during the pandemic. I'd been on maternity leave and I had a new baby, and I was really missing work and reaching people out there. And so I created this Instagram page with the themes of what is psychotherapy? What does it mean to be South Asian and want psychotherapy? Who are other South Asian therapists in your area? I really tried to help people find language and understand it because, again, there's just so much mystery around, like, what's an LCPC? What's a psychiatrist? What's a PsyD versus a PhD? Things that so many of us in the US still don't know.
Right.
But let alone if you grew up in a community that doesn't talk about it at all, you don't know who to talk to about it, right? So that's the way in which I try to reach the community. I've done standalone workshops on psychotherapy 101. Pay what you can, pay what you want. Just please show up and have you ask your questions.
So it sounds like you're really importantly just opening the door to what is psychotherapy, letting people know that this is it.
Yes.
This is what it looks like, and it's okay.
Yeah, it's a conversation.
Right.
It doesn't have to be so scary. It can be a conversation between two people that can be really healing. And also, I think most importantly, related to the topic of your podcast, right? I think people have thought trauma to be only something like rape or being in a war or being in a tragic car accident.
Right.
And I think people who come to me in the way I do therapy and the way we talk about it realize that there are other types of traumas, lots of interpersonal traumas that have occurred that they feel guilty labeling as trauma because they feel like they are talking negatively about their community, talking negatively about their families. They are abandoning their family values by calling out certain things that were problematic. But I think what I try to do is remove that stigma and say, like, it's okay. It's okay. No one is perfect. We're all human. But can we work towards healing and break those intergenerational cycles of trauma so that when we are parenting or when we are in partnerships, we're not replicating the way our families coped or did not cope or struggle to regulate themselves, right? How do we really increase insight and use more adaptive coping when we orient ourselves to the world?
You mentioned when I asked you about South Asian, what does it mean to be South Asian? And you mentioned Pakistan.
Mm-hmm.
And I'm thinking to myself, in a country like that where there's a lot of war,
Mm-hmm.
right? Relative to America,
Mm-hmm.
say, and they have their own problems. But in a country like that, people growing up in a country like that, where it seems trauma is just all around them,
Mm-hmm.
understanding what being traumatized means, it's got to take on a different definition. Like, this is just life. This is how we go about life. These
Mm-hmm.
things are going on all around us.
Mm-hmm.
Does that make sense at all?
You're saying, how is your question, how do we talk about trauma in the therapeutic setting here, given the different types of trauma that
Yeah,
they
I mean, it seems to me like you know, defining what trauma is in a word, and again, in a very general sense, to someone who maybe experiences wars on a much more frequent basis. I mean, this is their daily existence to a certain extent. And they might not have a name for this, what being traumatized means, but they're in it, so much more so. It seems like it would be very hard or difficult to extricate, to separate that out. Um,
Yeah, I mean, I liken this, what's coming up for me when you talk about it is I liken it to when I worked with veterans in the VA hospital here in the US, right here in Chicago. Vietnam War veterans, people who were in Afghanistan, Iraq. For some, they consider it like they are impacted by it because they were in combat for X number of years and had certain experiences. But not everyone who has been through those experiences, right, experiences
Sure.
PTSD.
Right.
Based on specific protective factors that they had. Right. So the experience of being in war, or being in combat, or being exposed to these things, I think really varies based off of other buffers that they've had.
Definitely. Right. Sure.
And so there's some Vietnam veterans who I used to say, thank you for your service. And they would say, of course, my honor. Others would say, don't you ever say that to me again. I never want to be thanked for that horrific thing you all made me do. Right. So the same experience can be really processed and loaded in one's psyche differently, right?
Yeah.
Based on their individual exposure to it, or the ways their families talked about it, or what they witnessed, or who helped them process it,
Yeah. I mean, for me, it's just impossible to fathom what it would be like growing up in a world where war is just ongoing.
Yeah.
So.
Yeah. Yeah, it's interesting because I always wonder what people would say even about our culture here in America, right? Some people have said to me, I can't believe I'm in Chicago, this scary place. You live in a place immersed with gun violence. My goodness. How do you walk outside? How do you raise kids? And I'm like, oh, I don't experience it like that, right? Yeah, there's a whole lot of violence in Chicago, but I have a lot of protective factors that allow me to live a life that's still very safe and very privileged, right?
Right,
And
right.
so I think my experience is going to be different than someone else who lives in other parts of Chicago that don't have the, daily gun violence and daily gang violence, right? Which is just a couple of miles away from where I'm speaking to you right now.
Right, right. Let me ask you about some early clinical errors. Any
Yeah.
ones that stand out to you?
Yes, that's a great question. I mean, this field, being a therapist, being a psychologist, right? It is so humbling. It involves so much inner work. So when I think of a clinical error, I'm sure I've made so many along the way. Absolutely. I still do it to this day, right? I pride myself in being human now, today too. But I think a lot about what I struggle with even now is how much to disclose. And so when I work with people of my own background and community, there's so many things that I can totally relate to. It hits so close to home. And I constantly think in sessions, is it valuable for me to share this? Is this important disclosure, clinically relevant disclosure? Or is this really me just trying to say, I know exactly what you're talking about, trust me, right?
Mhm.
And so I often go back and talk to my consultant specifically to say, did I mess up here? Because I feel like that was hitting me. I mean, what are the chances? This person's from my hometown, my sister's age, lives in the Midwest now, found me in Chicago. Like I had to say it.
Right.
And so I think I work through whether it's an error or whether it's actually sound clinical judgment to really connect with someone of my own background, right?
Mhm.
To show that I'm in it with them. I think that's something I constantly grapple with.
Mhm. Can you think of an example where, I don't know, more specific example? I mean, to me, when you were talking and you were saying, they came from this and this and this, and I know what you're feeling. That felt very relatable to me. I
Yeah.
felt, yes, I want to, that seems feels so healing.
Yes. Yes, absolutely. The topic that's been coming up recently a lot in therapy, in my therapeutic setting, is there are people who just so happen who are maybe in their late 20s, early 30s, getting married, and they are, I think this happens through a lot of cultures, but um, they've been talking to me about how they're getting married and they do not know how to honor their own wishes and needs, but also honor their parents' wishes for what a South Asian wedding is going to look like. Right.
Okay, right.
And so there are times, I want to say, oh my God, trust me, it created so much drama in my family. Like, I get it. Right. But what we often link it to is that when parents immigrate here, oftentimes, and are having this, huge milestone in their life of marrying their children off, so to speak, or having these weddings, to them, they're trying to honor their ancestry, their culture, their heritage. They want to have a wedding for their children the way they were raised to do so, the way they thought was respectful, the way they
Mhm.
thought was culturally and religiously and spiritually aligned with what their parents did for them, right? Whereas when you are of a generation like mine that's Indian American, I don't relate to that as much, right? I love the outfits, I love the music, I love the food, but please, I don't want to have a 2-hour ceremony in a language I don't understand.
Right.
But how do I honor my ancestors while also saying, can we just have like wine and cheese at the cocktail hour, right? Which is what I grew up with, right here in the U.S. But there's so much grief about saying, how do I create a boundary with my parents without disrespecting them and hurting them, where they will forever think about how I ripped them of this opportunity to have something of their own, right?
Right.
So I don't know if that's what you're looking for, but I think of that one of the disclosure moments, how it's culturally related, is
Mhm.
about how it's not just about a wedding. It's
Right.
not about boundaries and, oh, be individualistic or know yourself and push for what your needs and rights are. it's so much more complicated when you're including parents' grief and,
Mm-hmm.
expectations and, immigrant stories. I mean, I think a lot of parents are thinking about their own weddings and how their parents are no longer there to come and attend their child's. And so they're trying to create a bridge between this world they left and this world here. Whereas for people who are born here, like myself, it wasn't as emotionally loaded
Mm-hmm.
to do that,
Mm-hmm.
right?
For the therapists listening who are hearing this and saying to themselves, I'd love to learn about working with people of South Asian descent, population, where
Mhm.
would you direct them?
So
Any book or website or?
yeah, I would really urge clinicians working with South Asian folks to really try to be aware of their own implicit biases and assumptions about the person before them, right? Because being South Asian is so diverse and so rich based off of educational attainment, the person's caste, um, the reasons that they immigrated here. Was it because of religious persecution or was it because of academic opportunities, right?
Mm-hmm.
Really making sure that they understand the context of that person, I think, is very key. And one can Google things or read books about it, but I would certainly try to use that humility about not knowing about that person's background, right? And ask the individual, well, where do you think you'd like me to learn about this?
Mm-hmm.
Where can I know more about X? Or what do you think is most important to you about your culture? I will do my homework, but I would love for you to share with me what are the most um, salient factors you think are important for me to know. And what are things, if whether you're the same background or not, asking a client, what are things you worry about when working with someone who looks like me?
Mm-hmm.
Are you worried about judgment, assumptions? I think allowing for that conversation will be very important because many people from the South Asian background do not want to be disrespectful and don't
Mm-hmm.
know that you can actually challenge a therapist, right? Or say, hey, that didn't feel good when you said that, or you made that assumption. So I think just opening up that dialogue is going to allow for a lot more information about that person's background.
I really love that. Creating that space where the therapist can say, let's help me, and I love what you said, Belt. Where do you think I should go to learn more about? That's such a great thing to say, and it empowers the person sitting in front of you
Mhm.
too. And it also, by saying that, obviously you're being very humble, right? You're saying,
Mhm.
now, I mean, granted, again, this is case specific and everything, but there are probably some people listening that are like, well, I don't know. I couldn't do that. I don't know enough about them.
Mhm.
Why would they want to come see me? They're probably going to want to go see someone like you. What do you
Mm.
say to that?
I would ask them the question, what led you to find me as a therapist? Or why
Mm-hmm.
did you choose me as your therapist? I had someone, I've had people say to me, well, I don't know, you had a nice website. I've had other people say to me, I just like that you use the word trauma in your website. So I think knowing that information is going to be really important for you to know as a clinician, what does that client want you to know and what is most important to them right now? It might not be culture.
Mm-hmm.
Maybe it is, right? But I think that's just a really important springboard because again, they might have tools or websites or books after that, after you move through that phase, that will be very close to their experience. But you want to read about the right part of India, the right religion, or the right sect of Hinduism, right? Before you, or the right community of specifically Catholic Indians, because if you're just reading about the country at large, you're going to be missing out on what is
Right.
important to that person.
Right. All right, Shanta, as we kind of close out here, what's the best way for people to get in contact with you?
Sure. So I can be emailed at Dr. K at snktherapy.com. SNK are my initials, so Dr. K at snktherapy.com. I can also be found on Instagram at snk_therapy. So people are welcome to follow me there, see my content, but also message me directly there.
Okay.
And I, again, love meeting people in the field. I love connecting people to therapists, but also if people do need resources or want to collaborate, I just love reaching the community. So feel free to reach out. I'd love to connect with you.
Awesome. All right, Shanta, I really appreciate you taking the time. It's awesome.
You too. Thanks so much.
All right, take care.
Take care.